लेकिन थोड़ी तो मदद करो, थोड़ी तो मदद करो। लाखों के रुपए मैंने खर्च किए अस्पताल के बिल में, पैसे नहीं है चिता में आग लगाने के लिए, थोड़ी तो मदद करो। यही तो मांग हमारे दल के नेता राहुल गांधी जी कह रहे हैं कि जिन परिवारों में कोविड के कारण किसी की मृत्यु हुई, क्या सरकार उनके पास देने के लिए क्या 4 लाख भी नहीं है आपके पास? क्या 4 लाख भी आप दे नहीं सकते? और यह घोषणा किसकी थी? यह घोषणा आपकी थी। आपने ही पहले कहा था कि नेशनल डिजास्टर मैनेजमेंट एक्ट के तहत हम लोगों को आर्थिक हम मदद करेंगे, और 4 लाख का आंकड़ा आपने ही लाया। और फिर आपने देखा कि क्यों कि ये किसी तरीके से आपके जो आर्थिक आपके जो कैलकुलेशन है उसमें नहीं फिट होते, तो आपने इसको घटाकर 50,000 कर दिया। अरे आपके पास पैसे की इतनी कमी है तो कॉर्पोरेट पे टैक्स बढ़ाइए, गरीब पे क्यों टैक्स लगा रहे हैं आप? पेट्रोल का टैक्स, डीजल का टैक्स, जीएसटी का टैक्स, यही मांग है। क्या ये मांग जायज नहीं? क्या ये मांग जायज नहीं कि बेरोजगारी और मूल्य वृद्धि इन्फ्लेशन के दौरान, कोविड के महामारी के दौरान चिकित्सा जिसमें नहीं मिल रही, आज लोग आपके हाथ फैलाकर, झोला फैलाकर आपसे मदद मांग रहे हैं, और इन्हीं लोगों को नेतृत्व और इन्हीं लोगों के मांग आज राहुल गांधी जी आपके समक्ष रख रहे हैं। क्या गलत किया हमने? क्या इस पे भी हम पे आरोप लगाएंगे आप? क्या इस पे भी हमने कुछ गलत किया है? आज सरकार हमें स्पष्ट रूप से बताए कि वास्तविक सच्चाई क्या है। डरिए मत, लेकिन यह तो बताए कि कोविड के कारण आज कितने लोगों की मृत्यु हुई है। क्योंकि अस्पताल में दिखाया जाता है कि कोविड के कारण मृत्यु हुई है, डेथ सर्टिफिकेट में लिखा होता है, और लेकिन जब वहां पे शमशान में जाते हैं तब तो बदल दिया जाता है। आज आपके ही नेशनल फैमिली हेल्थ सर्वे के पोर्टल, और मंत्री महोदय यहां पे है, आपके ही नेशनल फैमिली हेल्थ पोर्टल में HMIS का जो सिस्टम है उसमें 2021 के महीने में, 2021 के मई महीने का आप निकाल लीजिए आंकड़ा, और 2021 के मई महीने में जो लोगों की मृत्यु की तादाद की जो संख्या आपके पोर्टल पे है, वो पिछले साल के मई महीने से 3 लाख ज्यादा है। 3 लाख ज्यादा है। ये प्रमाण करता है कि आज भारत सरकार कोविड की जो के कारण जो वास्तविक मृत्यु की आंकड़ा है वो हमको नहीं पता चल रहा। ये सब लोग कह रहे हैं कि आप क्यों एक डाटा ऑडिट करिए, लोगों को सच्चाई पता होनी चाहिए, लोगों को ये शांति मिलनी चाहिए कि हाँ मुझे पता है कि मेरे परिवार में किसी एक सदस्य का कोविड के कारण मृत्यु हुई है, लेकिन ये सच्चाई की शांति भी आप नहीं देना चाहते। आपने अपने HMIS पोर्टल में लिखा है कि नहीं, कोविड के कारण मृत्यु नहीं हुई है, बुखार के कारण हुई है, सर्दी के कारण हुई है, अनजाने की कोई विषय है, अनजाना कोई कारण है, उसके कारण है हुई है मृत्यु। क्या सच जानने की भी आज अधिकार क्या भारत के आवाम के पास नहीं है? सच्चाई तो मांग करी है आपसे। आप बताएं आज मैं ये नहीं बोलता कि ये सिर्फ केंद्र सरकार में, हर राज्य सरकार को करना है। इसमें केंद्र सरकार, राज्य सरकारों को मिल बैठकर काम करना है। आपकी तरफ से गाइडलाइंस आनी चाहिए, और शायद आपने गाइडलाइंस दिए भी हैं कि डेथ को किस प्रकार से हमको रिकॉर्ड करना है, पर उस गाइडलाइंस में इंप्लीमेंटेशन क्या हुआ है? हमारे पास हमने देखा है कि 2020 में मदुराई में एक स्टडी हुआ था, मदुराई शहर में एक स्टडी हुआ था 2020 में, उसमें दिया गया है कि वास्तविक में जितने लोगों की मृत्यु हुई है उसमें से सिर्फ 11% को कोविड के कारण ये बताया गया है, जबकि संख्या और बड़ी होनी चाहिए। यही तो आप लोगों की जवाबदेही है। इसलिए तो हम सदन में आते हैं, ये टोका टोकी करने के लिए नहीं, ये जानकारी, ये सच्चाई लोगों के सामने लाने के लिए हम पार्लियामेंट में आते हैं। और आपने क्या किया कि पहले दिन आके ही आपने बिल ऐसे निकाले लोकसभा में जिसपे चर्चा नहीं हुई, और राज्यसभा में 12 लोगों का आपने निलंबन कर दिया। क्या आप नहीं चाहते कि चर्चा हो? आप तनाव का एक माहौल पैदा कर रहे हैं पार्लियामेंट में। हम चर्चा के पक्ष में हैं, हम चाहते हैं कि आपने जो अच्छा काम किया है उसकी आप वाह ले, और जो आपने काम नहीं कर पाए उसका भी श्रेय ले। लेकिन अफसोस की बात है कि जब विफलता की बात आती है तो इल्जाम लगता है विपक्षी दलों पे, जब विफलता की बात आती है तो इल्जाम लगता है राज्य सरकारों पे, पर जब श्रेय लेने का समय आता है तो श्रेय जाता है सिर्फ एक व्यक्ति को। यह कैसा नेतृत्व हुआ? नेतृत्व का मतलब कि सफलता भी उनकी और विफलता भी उनकी। यह नेतृत्व का नहीं स्वीकृति है कि विफलता आपकी और सारी सफलता मेरी। यह नेतृत्व का चरित्र नहीं है। आज मैं आपसे मांग करता हूं कि आज आप हमें स्पष्ट करिए कि आने वाले समय में क्या होने वाला है। आपने प्राइवेट सेक्टर, निजी सेक्टर को 25% वैक्सीन लेने का आपने अधिकार दिया। कितना वैक्सीन उन्होंने लोगों के बीच में दिया? क्या ये ब्यौरा है आपके पास? आज वैक्सीनेशन को भी आपने आउटसोर्स और प्राइवेटाइज कर दिया। आप बताइए कि प्राइवेट सेक्टर में जो 25% वैक्सीन उनके पास है, कितने यूटिलाइज हुए हैं, कितने अंडर यूटिलाइज हुए? क्योंकि हमको जानने में आया है कि आज प्राइवेट सेक्टर के पास, प्राइवेट अस्पतालों के पास वैक्सीन तो है, लेकिन लोगों के बीच में जिस प्रकार से डिस्ट्रीब्यूट करना था वो नहीं कर पाए। आज आपसे हम जानना चाहते हैं कि बूस्टर डोज पे आपकी क्या स्थिति है। बहुत से हमारे वृद्ध, हमारे दादा दादी, नाना नानी हैं जिन्होंने 2 डोज ले लिए हैं, पर उनको और हम अधिक संरक्षण देना चाहते हैं, उसको हम बूस्टर डोज देना चाहते हैं। कहां है आपकी बूस्टर डोज पे पॉलिसी? आज विभिन्न देशों में 18 से आयु से कम वर्ष के बच्चों को वैक्सीन मिल रहा है। हमारे बच्चों को कब वैक्सीन मिलेगा? आज अपने जनसंख्या को लेकर आप बड़ी बड़ी बातें तो करते हैं, लेकिन सर ये वैक्सीन सिर्फ 18 वर्ष और से ऊपर के लोगों को मिला है। 18 वर्ष के कम के लोगों को क्या हुआ? कब मिलेगा उनको वैक्सीन? ये हम जानना चाहते हैं। हम जानना चाहते हैं कि आप कोविशील्ड के बीच में जो ये 3 महीने का गैप है, इसको आप क्यों नहीं कम करते? जब थर्ड वेव आ सकता है, जब नया वेरिएंट आ सकता है, आज ओमाइक्रॉन है, कल कोई और होगा, तो क्यों आप लोगों को डबल डोज के लिए जल्द से जल्द को डबल डोज मिले, उनके जो बीच में कोविशील्ड की जो वैक्सीनेशन गैप है इसको क्यों नहीं कम करते? क्योंकि दूसरे देश में तो 2 महीने का है, लेकिन भारत में 3 महीने का, जिससे कि क्या होता है कि जो वैक्सीन की सुरक्षा कवच लोगों को मिलनी चाहिए, उनको जल्द से जल्द नहीं मिलती। और वैक्सीन को लेके मैं अच्छा लगता है, मुझे भी अच्छा लगता है कि जब मैं कोविन का पोर्टल देखता हूं कि आज 17 सितंबर को प्रधानमंत्री जी के जन्मदिन पर 2.5 करोड़ लोगों को टीकाकरण लगता है। मुझे भी अच्छा लगता है कि चाहे जितने और लोगों को टीकाकरण मिले, उससे वो और सुरक्षित होंगे, तो इससे हम भी सुरक्षित महसूस करते हैं। लेकिन हम क्या देखते हैं कि 17 तारीख को तो आपने 2.5 करोड़ टीका लगा दिया, लेकिन उससे एक दिन पहले सिर्फ आपने 1.63 करोड़, उससे 2 दिन पहले सिर्फ 96,000। ये मैं बता रहा हूं, ये असम का, कि आप ये असम का बता रहा हूं मंत्री महोदय, कि ये आपने 2.5 करोड़ आपने लगाए 17 सितंबर को। ये 2.5 करोड़ आंकड़े पे आप कैसे पहुंचे, उसका उदाहरण मैं असम का देना चाहता हूं। असम को भी 17 सितंबर को 7.9 लाख वैक्सीन दिए गए थे प्रधानमंत्री जी के जन्म तिथि पर। 7.9 lakhs on 17th September. But one day before that, it was 1.63 lakhs. 2 days before that, it was 96,000 only. And 4 days before that, it was 2 lakhs. So leading up to the Prime Minister's birthday, vaccine level is at this. 2 days before Pradhan Mantri's birthday, vaccine level drops. And then on the day of Pradhan Mantri's birthday, it jumps. And on the day after, it falls. How is that possible? How is that possible? It should continue. It should continue at that same level. आप देखिए, आप मुझे 18, 19, 20, 21 सितंबर का मुझे ब्यौरा दीजिए, आप मुझे अक्टूबर महीने का ब्यौरा दीजिए, और मेरे नवंबर का ब्यौरा दीजिए, कि अगर आपने एक प्रकार का ऐसा एक जन जागरण आपने पैदा कर दिया कि एक दिन में 2.5 करोड़ लोगों को आपने वैक्सीन दी, बधाई उस बात को, लेकिन वो 2.5 करोड़ आपने अगले हफ्ते, अगले 2 महीने तक क्यों नहीं रख पाए? क्यों दोबारा बार कभी 30,000, कभी 50,000? मैं आसाम की बात कर रहा हूं, ऐसे बात हो रही है, ये अप एंड डाउन क्यों हो रहा है? तो इसीलिए हम चाहते हैं कि ये जो काम आप कर रहे हैं, इसको आप सादगी से करिए, इसको आप ईमानदारी से करिए। हम कोविड योद्धा के हिसाब से सबको नमन करते हैं, सबके प्रति हम आभार व्यक्त करते हैं, उन डॉक्टरों के प्रति, उन नर्स के प्रति, और विशेष रूप से उन आशा कर्मी के प्रति। वो आशा कर्मी आज उनके पास घर का पैसा नहीं है, लेकिन वो साइकिल चला के खुद या चल के घर में जाके आज वो वैक्सीन की टीका लगा रही है।
गौरव जी,
वैक्सीन का टीका 2 मिनट
ओके,
वैक्सीन का टीका लगा रही है, लेकिन आज क्या उनको जो उनका वेतन है मिल रहा है? 2 महीने से कुछ लोग अपने वेतन के लिए तड़प रहे हैं। शाहजहांपुर में जब उत्तर प्रदेश के पास मुख्यमंत्री के रैली में जब आशा कर्मी जाते हैं तो पुलिस के लोग उन पे लाठी बरसाते हैं। ये कैसा कोविड योद्धा का सम्मान हुआ? आपने दर्जा तो दिया, लेकिन जो आपको सहायता करनी चाहिए थी, आर्थिक सहायता करनी चाहिए थी आशा कर्मियों की, उन महिलाओं की, आपने नहीं की। उन आशा कर्मियों के कारण ही इतिहास में जब यूपीए की सरकार थी, हमने पोलियो को खत्म किया था। वो घर घर में जाए थे। तब उस समय में हमने प्रधानमंत्री मनमोहन सिंह जी का फोटो हमने सब टीका पे नहीं लगाया था। हमने बस अपना काम किया था। हमारा कर्तव्य है कि हम घर घर में जाएं, जन जागरण पैदा करें, विभिन्न संगठनों की सहायता लें, डीजी सेक्टर, एनजीओ सेक्टर, और तब जाके हमने पोलियो को खत्म किया। आपको क्या है? आपको प्रचार से है। हर वैक्सीन पे आपको प्रधानमंत्री मोदी जी का आपको फोटो लगाना है। किसी देश में ऐसा नहीं है कि वैक्सीन के सर्टिफिकेट में कि प्रधानमंत्री का फोटो। आज इसीलिए आज हमने इस कोविड से हमने क्या सीखा है? इस कोविड से हमने सीखा है कि आज हमको अपनी अर्थव्यवस्था पे जोर देना है, क्योंकि ये वास्तविक सच्चाई है कि पिछले 1.5 साल में, अभी ये जो आप जीएसटी की बात कर रहे हैं, जीएसटी बड़ा है 1 लाख करोड़, पर आप ये बताइए कि भारत में 80% इनफॉर्मल सेक्टर में है। वो आज इनफॉर्मल सेक्टर की आप खुद अपने कॉन्स्टिट्यूएंसी में जाके पूछे कि उन इनफॉर्मल सेक्टर का क्या हाल है। आज एक ऐसी रिकवरी हुई है, ऐसी एक आर्थिक रिकवरी हुई है जहां पे अमीर और अमीर हो गया है और गरीब हो गया है। इस अंतर को हमको खत्म करना है, इस अंतर को हमको कम करना है। धर्म जरूरी है, लेकिन धर्म के साथ साथ हमको इंसानियत दिखानी है। आज इस महामारी के समय हमको एकजुट होना है। देशवासियों की सेवा में हम सब है, हम आपके साथ हैं। जहां जहां हमारी राजनीतिक सरकार है वो आपके साथ है, जहां जहां हमारे सरकार नहीं है हमारे दल आपके साथ है। हमारे युवा लोगों ने, युवा कांग्रेस ने दिल्ली में, जहां पे हमारी सरकार नहीं है, जगह जगह घरों घरों में जाके उन्होंने लोगों की मदद की है। और ये आप माने ना माने, लेकिन सब मानते हैं। इसीलिए मैं चाहता हूं कि आप जो आज की तारीख में जो हमको क्या सीखना चाहिए कि आज भी हमारे अस्पतालों में जो प्राइमरी हेल्थ सेंटर है, पर्याप्त डॉक्टर नहीं है, बिस्तर नहीं है, ऑक्सीजन बड़े बड़े सिलेंडर्स नहीं है, उसको हमको अपने हेल्थ सेक्टर में इंप्रूव करना है। हमको क्या सिखाई मिली है कि आज बहुत से बच्चे स्कूल से ड्रॉप आउट हुए हैं। आज वो धीरे धीरे स्कूल में जा रहे हैं, लेकिन पिछले 1.5 वर्ष से वो स्कूल ढंग से नहीं कर पाए क्योंकि उनके घर में स्मार्टफोन था ही नहीं। तो ये जो वो उनके परवरिश में जो खामियां हुई है, जो कमी उत्पन्न हुआ है, उस कमी को हम कैसे पूरा करें। हमको आज कोशिश करना है कि आज जो आर्थिक आज जो हम दबाव हम अपने गरीब पे डाल रहे हैं, उस दबाव को कम करें। पेट्रोल का प्राइस कम करें, डीजल का प्राइस कम करें, एलपीजी का प्राइस कम करें, सब्जियों और विभिन्न खाद्य के पदार्थों का प्राइस हम कम करें। आज उनकी मदद की, भारत के लोगों की मदद की समय आ चुका है। समय आ चुका है कि भारत के लोगों को हम सच्चाई दें कि कितने लोगों की वास्तविक आज कोविड के कारण मृत्यु हुई है। समय आ चुका है कि आज भारत के लोगों को हम वो 4 लाख का एक आर्थिक सहायता उनको आगे दें। सभापति महोदय, आप प्रचार करिए। सरकार से मैं कभी नहीं कहता कि आप प्रचार ना करें, लेकिन प्रचार सच के बूते पे होना चाहिए, झूठ के बलबूते पे नहीं। इन्हीं मैं शब्दों के साथ मैं अपनी बातें रखता हूं। धन्यवाद।
धन्यवाद। Honorable members are informed that those who wish to place the written speeches, you are allowed to place the written speeches on the table of the House. Next speaker is Dr. DNV Sindil Kumar.
Vanakkam, Chairperson. I would like to draw the kind attention of this House regarding the new coronavirus strain B11529, which has been identified in Botswana, South Africa region, where World Health Organization has classified a new strain as high-risk variant of global concern, which has named the heavily mutated strain as Omicron. It has spread to Australia, Italy, Germany, the Netherlands, Britain, Hong Kong, and Belgium. Because Omicron reportedly has more than 30 spikes, which is double the number of the Delta variant, which makes it potentially more dangerous with a higher risk of reinfection. Since its time of detection, it has outpaced the Delta variant and become the dominant strain in parts of South Africa and is a greater cause of concern which might have effect on India. So regarding the COVID situation, be it the first phase, second, or the anticipatory third phase, the government's reaction has always been reactive and not proactive. Initially, there were confusions in the travel advisory, and proper screening was not done at the airports at the beginning month of Jan-Feb. And suddenly, the Prime Minister appears and he announces a 21-day lockdown with just 4 hours, with no preparation or no prior warning to the common man. And during these 21 days of the lockdown, the people were put into much suffering. There was shortage of PPE, the face shields and masks during the first phase. And there was a breach on the state federalism, because health being a state subject, it was the central government which took the procurement of masks, PPE and other things, which the state should have procured. And the delivery of the kits at the initial phase was not of the standard quality for the doctors and frontline warriors to battle with. It was even at a later stage that the government stopped or banned the export of PPEs which were required in India. Regarding the MP Lads Fund, when all the members had given letters for their specific districts to be covered under the MP Lads, the government had taken an unanimous decision of taking away the MP Lads Fund for 2.5 years, 2 years. So what happened was, each member who could have uniformly distributed to all states and all districts, the 534 members of this house could have equally distributed the MP Lads Fund just for the corona cost. We don't have any objection in the government taking away the MP Lads. But if it was used for each district and each constituency, it would have had much more impact. Now we don't know what is the status of the MP Lads which was taken away and for what specific purposes was it used. So regarding the migration of labours, after the India-Pakistan migration, this was seen as was brought out as the biggest migration of the nation, where thousands and thousands and thousands of migrant laborers were just left alone, and they were seen walking with so much of sad stories, small children, ladies and all. And during all this time, what did the government do? What did the Prime Minister do? The Prime Minister was seen feeding the ducks. The Prime Minister was seen posing with the peacocks. Nothing was done to address the common man. That is, the common man was just left to himself. Isn't it the role of the government to take care of its citizens? Isn't it what democracy means? The government, what did it do during the 6 months of lockdown? It had just left its citizens alone. There were corporate shops given for corporate firms. But what about the unorganized sector? What about the street vendor? What about the barber? What about the driver? What about the hotel? What about the restaurants? What about the travel agencies? Who took care of them? For 6 months, there was no support from the government as such. And regarding the financial help, it was not rendered at all to the common man. And regarding the doctors, nurses, healthcare workers, the ambulance drivers, the compounders, the technicians, no help was given to them. And the police personnel who were taking care of the country during the 6-month lockdown, or the number of deaths that they had faced was reduced and was not given as a proper status. The Indian Medical Association had come out with a proper data and said that the then Health Minister's data which he had given, that the number of doctors who were expired due to COVID, there was a vast difference between the two of them. And this all showed the failure of the government. And during the second phase, in spite of repeated warnings during the last session, during the last winter session by almost all the members, saying that the second wave is going to come, the government didn't heed to anybody's request. During the November 2020 Standing Committee of Health, which I am a member, we had given a warning, stern warning to the government that there is going to be shortage of oxygens and ventilators, which the government has to gear up. But there was no voice heard, and ultimately, if the first wave was a shortage of mask, PPE kits and sanitizers, the second was a shortage of beds, oxygens and ventilators. The second wave came more vigorously, causing stronger effect, deaths even to the young people. All families were affected. All families in India, there was at least one person in the family affected by corona, and among the relatives of the families, there was at least one death in all the families in India. after DMK came to power with the Dravidian principles and ideologies, with Periyar's dream, with Anna's plan, Kalaignar Karunanidhi's execution, and CM MK Stalin's delivery of schemes to the last village and the last man. The whole government machinery in Tamil Nadu was focused on controlling the second wave. All ration card holders were given a monetary benefit of rupees 4,000 so that they can have at least one impact financially for them to be supported. As a result of the oxygen generator plants which the government took initiative, now all districts in Tamil Nadu have at least 2 oxygen plants in each district in Tamil Nadu. And regarding the beds, there are around 300 to 1,000 beds with oxygen supply, extra beds which are readily available for the anticipatory of the third wave. And regarding the vaccination camps, so first we saw a big confusion of vaccination. First, the government came up with saying that only the frontline workers will be given free dose of delivery of the vaccines. Then, upon insistence, it was then said 65 years. Then when the states had to go for a procurement of vaccines, then the Supreme Court had to intervene, and it was then decided that the vaccines would be given free to all. And sir, taking the example in Tamil Nadu, vaccines, we have conducted more than 5,000 camps per week around Tamil Nadu, and we have been vigorously going after them. And sir, Tamil Nadu has been an example of giving free vaccination even in private hospital sectors, where under the CSR scheme, even if it's not that you will have to take a vaccine shot from the government hospital, you can even have it free from the private sector. So regarding the Chengalpattu HBL vaccination center complex, which has already been established, but it has not been operational. Our Chief Minister has been consistently asking the central government to open up the vaccination complex, and even given a suggestion that even the Tamil Nadu government will take up this complex and run. But till today, the government has not heeded, and there are words that it is going to be given to a private organization. Schemes implemented in healthcare, which have not even been heard of even in developed nations, have been implemented in Tamil Nadu. So healthcare reaching to the doorsteps of the common man, where the medicines for 30 days for diabetes and blood pressure, hypertension are given at the doorsteps of the common man. These schemes are not there even in developed countries. We have been setting role models in health throughout Tamil Nadu, which can be, if implemented throughout India, will stand out as a very outshining nation. So our Chief Minister is setting the bar high day by day and exceeding expectations. The TN model is to be implemented throughout India. As in just more than 200 days of rule in DMK, the CM, MK Stalin, has been voted as the #1 Chief Minister, and Tamil Nadu has risen to the rank of #1 state in Tamil Nadu. So last, I would like to bring that during COVID, the farmer agitation which had taken place had taken away 700 lives. I sincerely urge upon the government to give a compensation to the 700 lives as a compensation to them. And special thanks to all the farmers and agriculturists, especially to Punjab farmers and Tamil Nadu state government for passing resolution to repeal the farm law. So the lesson learnt is people's protest is stronger and has more value than the government's autocracy, and will have to succumb to people's voice. This is the spirit of Indian democracy. Thank you, sir.
Thank you very much. Next speaker, Dr. Kakoli Ghosh-Sidar.
Thank you, sir. I think it was high time that we discuss this very important issue which is plaguing the world, and it is a privilege that during the all-party meeting, the Lok Sabha leader of our party, Sudeep Bandyopadhyay ji, he raised the topic that COVID needs serious, detailed discussion in the House. So when we are discussing it today, I wish to thank all the speakers who have already spoken. But I would like to point out that when we started with this disease nearly 2 years back, we were ridiculed. At the end of 2019, whether it was August or it was December, is still to be decided, when the Chinese city of Wuhan saw the first set of diseases, we were banned from wearing masks in the House, particularly in the Rajya Sabha. Our honorable members, they were directed to leave the House or remove the masks. That just goes to prove how immature in thinking this government is. and how unaware they are.
Yes, madam.
Of
Don't quote the proceedings of Rajya Sabha. It's against the rule.
We were not allowed to wear masks
Okay.
in the parliament, and the government was unaware of the very serious condition of this disease. This disease is one of the respiratory apparatus. Now, I am not an entomologist, I am not an epidemiologist, I am not a virologist. But as an ordinary person, ordinary doctor, you see, I would like to remind this august house of the devastation seen some hundreds of years ago, when Europe was absolutely devastated with plague. Or after that, smallpox was there in the United States of America, after which a lot of stories made the rounds regarding the advent of smallpox in the United States of America. So maybe hundreds of years down the line, some stories are going to emerge regarding the advent of this particular virus. Because as we studied, virus is a self-limiting disease. Virus kills itself on the way as it goes on creating disease. Here we see this virus is not dying. This virus is mutating. Mutating means it is changing its character so that it is becoming immune to therapy and it is killing more people. So this mutating virus, is it man-made? Then how was it created and how was it let loose amongst the world? Is a big question which a lot of researchers are thinking about. Now, due to the coronavirus, since 2019, we've lost so many lives. Usually, it takes about 5 to 10 years to produce a vaccine. But my salutation here on this august house, this platform, is to the researchers and the doctors who have worked and devised the vaccine within 8 to 10 months after advent of the disease. And the salutation also goes out to the doctors who were working. They were the frontline fighters all over the world. You see, we can't keep on a mask for 1 or 2 hours. We can't speak with the mask on because it suffocates us. But the doctors were putting on the PPE, the personal protective equipment, in the sweltering heat of the month of May, and looking after patients, trying to revive them, trying to resuscitate them. They were going through so much of dehydration. More than 700 doctors died in 2020, and more than that in 2021. Nurses have lost their lives. ASHA workers and police people have lost their lives. My salutation goes out to all of them who have been the frontline warriors. This is a war. This is not a disease. This is like a world war. And we are facing the war. We are with the people. We have to be with the people. This government should have been more careful, because the vaccines that were produced within a very short span of time has not been used properly. We advertised that we've completed 100 billion, but what about the second dose? Why can't we complete the second dose, which we were supposed to complete by December or January? Why haven't we done it yet? Also, there is suggestion by the experts all over the world that people who are over the age of 65, who have comorbidities, they should be given the booster doses. What is the policy of this government regarding the booster doses? What is the policy of this government regarding inoculating or vaccinating the children or the young adults, because they are our future? Now, when so many people have died, the doctors are sometimes blamed. I don't want to name the person, but an honorable speaker was just now blaming the doctors. The doctors have fought this battle on their own here, without ventilators, without oxygen supply, without oxygen concentrators. I would rather suggest and request honorable minister sitting here that after the time of independence and before that, there was an Indian medical service like Indian Administrative Service. Why don't we bring back that Indian medical service in which there are medical administrators who will look after the administration part of the medical calamities and also the delivery system? because we might see more of this that we are seeing today. The World Health Organization has brought out advisories on the 26th of November because they are quite worried about the mutation. There are spike proteins on this virus, and there are nearly 30 mutations on the spike proteins. What does the spike protein do? It attaches itself. This virus, it enters through the nose and mouth. It remains within the air spaces behind our nose for a day or two, and then it travels downwards to the respiratory apparatus, that is the lining of the lungs. It prevents us from breathing. The severe adult respiratory syndrome related to the COVID virus 19 is because the lining of the air spaces is affected by this virus. And that is why the advisory is to cover the nose and mouth so that the virus doesn't enter. That is the advisory, that you stay away from the next person at least 1 meter, that is 3 feet, preferably 6 feet, so that when he's speaking, when the person is breathing, we don't transmit the disease. The advisory is that you keep the windows and doors of the room open, have the fan on, so that there is ventilation and the virus goes out. These are the advisories being given out by these experts so that we prevent this virus from entering through our nose and affecting our lungs. And the World Health Organization has now designated this variant as B.1.1.529, a variant of concern. They are very concerned. World Health Organization is very concerned with this particular variant, Omicron, which seems to be much more dangerous than the previous ones, the Delta. And we had this Omicron suddenly on us. The advice of the WHO's Technical Advisory Group on Virus Evolution, they are suggesting that these mutations may have an impact on how this virus behaves, how it reacts to the vaccine, and how it kills the person. So we have to go through the WHO warnings and make our people aware. Generally, it has been seen that this virus is causing fever and it is giving us severe respiratory disorders. Particularly, patients with comorbidity are prone to die. Now, it is not yet decided whether Omicron is more transmissible, whether it is transmitted more or not than the previous ones. But we have to be careful. The severity of the disease is also not yet decided because Omicron is pretty new in the field. But definitely, no information is still there to suggest that symptoms associated with the Omicron are different from those of the other variants. The vaccine, if 2 doses are given, it definitely prevents severe disease and death. But mild disease will still occur. And with the mild disease, there will be morbidity in the society. There may be increased risk of reinfection with Omicron for people who have previously had COVID-19 with other variants. So it is not that a person who's got COVID-19 before with another variant of Delta or the other ones, they will not get. They will also get the disease. So the vaccines remain critical to reducing the severe disease. Now it is said that India produces 60% of the world's requirement of vaccine. And a CEO, particular CEO of a Pune-based farm, he is saying that he's got enough stock for the second dose for the whole of the country. Then why our government here, instead of vaccinating with the second dose the whole of the country's population, had to export the vaccine? For whose benefit was vaccine exported and not given to our own people? Why isn't there any advisory regarding the booster doses? Because the government is trying to deprive the citizens of India and earn brownie points from outside other countries. I'm not saying you don't help other countries. If we have access, we'll definitely help other countries. Everybody should be self-sufficient. But why we cannot complete the second dose and why we cannot give the booster dose to our elderly people, it simply beats me. I don't understand. And the treatment, as far as this new variant is concerned, is still to prevent the cytokine storm that is related to the injection of the corticosteroids and the interleukin-6. But whether the remdesivir that has been useful for the previous variants will be effective here or not, whether their claimed drug, a particular company is claiming that the drugs have been brought out, whether we are aware of it in the government, whether we have enough stock of the drug, we would like to know. The House wants to know whether we have the drug, enough stock of the drug to help us, because it is said that this drug will prevent this disease, this will cure the disease, and the most effective steps that we can take is by maintaining the distance and also wearing the masks. There is no two way about that. Omicron has about 50 mutations, including more than 30 mutations on the spike proteins. The region of the virus that binds to and allows the virus to enter the human cell is the spike protein. One reason scientists are raising early concerns about Omicron, even before it has proven itself to be a true threat, is because it contains several mutations that made earlier variants, the alpha, beta, and gamma, delta, more transmissible and better able to evade the immune response. We, after vaccination, get an immune response. But this is evading the immune response. So we have to be more careful. Fortunately, the vaccine responses aren't all or nothing. It's not that, even after vaccination, the body doesn't respond. The body will take some response. The body will respond to the virus. So severe disease will be prevented. Death will be prevented by only giving the vaccine. The only answer to the disease now is vaccination, complete vaccination with 2 doses for the whole of the population. That is as far as the vaccination goes. As far as the scientific basis goes, the evidence is clear that the type of the immune response from the heterologous approach of a particular brand of vaccine, that is the AstraZeneca or the Johnson & Johnson, followed by an mRNA vaccine such as the Pfizer or Biotech, induces superior neutralizing and cell-mediated immune response than 2 doses of a non-replicating vector vaccine. That is, they're saying you mix up the vaccine, that gives you better, larger area of action for the virus to be trapped.
Yes, madam.
Immediately, high-risk groups should be given the boosters, and the question remains whether the government is prepared to let us know the status of the ventilators available, the number of ventilators, because we've seen the PM Care Fund fail drastically. We have seen how laborers were affected adversely when sudden lockdown was announced. There was loss of GDP, loss of earning for them. So what the government has done to take care of that? There should not be any haphazard lockdown as far as the World Health Organization data goes. They are saying there is no need of lockdown just right away. You can keep the airports open, travel open, but with the mask on. That is what the advisory says. So the House wants to know, what is the plan of the government? How do you propose, to protect the people, the citizens? And how do you propose to stand by the doctors who've been working so hard? There weren't any ventilators. There was lack of oxygen supply. There was lack of oxygen concentrators. How do you propose to stand by the different communities, the different sectors of people who have lost their jobs? And what is the growth? What was the growth in the last few years? How many total beds has the government prepared? Like in West Bengal, our Chief Minister Mamata Banerjee, she's kept even today 30,000 beds ready for any type of calamity, any type of third wave if it comes along. So what is the total number of beds kept ready, COVID beds in the country? What is the total number of oxygen supply? What is the total oxygen production here in the country? How many vaccines are still there that people are looking at? What is the stock of the medicine that is being said to cure the disease? And what is the idea of compensating the people who've lost their lives in the COVID? What is the idea for the people who are suffering and not getting any jobs because of the COVID? They've lost their jobs. What is the government's proposal? We want a complete status report. A decision has to be made how we are going to tackle this if the third wave comes or if Omicron becomes bigger than what we have experienced in the past. Thank you, sir.
Thank you. Next speaker, Srimati G. Madhaviji.
Honorable Chairman, sir, I would like to thank you for giving me an opportunity on behalf of YSR Congress Party to bring to the notice of this August House the need for having a discussion on Omicron variant that is a concern, causing a concern around the world. On Friday, the World Health Organization classified a new variant of SARS-CoV-2 currently circulating in the South Africa as a variant of concern. It is also named it Omicron. Early instances are that this variant is possibly even more transmissible than the highly infectious Delta variant, and the current vaccines may be less effective against it. The new variant was first reported to WHO from the South Africa on 24th November 2021. This variant has a large number of mutations, some of which are concerning. Preliminarily, evidence suggests an increased risk of the infection with this variant as compared to the earlier Delta variant. Sir, around 20 countries and territories around the globe now have suspected or confirmed cases belongs to the Omicron variant. The latest entered to the growing list was Japan, which confirmed the first case after it closed its borders for the foreign travelers. While India is yet to report any cases, authorities remain on high alert. Both the central as well as state governments have announced a slew of preliminary measures to counter the variant. Much remains unknown about the new variant. About the rapid surge in case has quickly many nations to enact strict measures to counter this variant. In this regard, we should consider measures like banning international flights from countries where such cases have been detected in large number. And as Omicron has been designated a variant of concern, there are several actions WHO recommends countries to undertake: increase surveillance and sequencing efforts through the better understanding circulating SARS-CoV-2 variant, submit the complete genome sequences and associated metadata to a publicly available database such as GSAID, report in initial cases associated with VOC infections to WHO through the IHR mechanism. In my state, Andhra Pradesh, Honorable Chief Minister of Y. Jagannath Reddy conducted a review meeting on COVID-19 situation to new variant of concern Omicron. The state government will take all necessary precautions to stop the entry of new variant in the state. It will focus on arrival of international travelers to prevent its spread. In the review meeting, the CM asked to the officials to send special medical teams to the Hyderabad, Bengaluru and Chennai airports to scan international passengers ahead to the Andhra Pradesh. He asked the officials to conduct only RT-PCR tests to avoid rapid testing. If any traveler tests negative, they will be allowed to produce their destinations, will be under observation for some time. If any passenger tested positive, his or her sample would be tested for genome sequencing to identify the variant of the various they were infected with. The state government is also planning to procure genome sequencing testing machines to detect the variant within the state quickly. Sir, with the Omicron variant, there have been concern raised for the administration of third booster dose of COVID-19 vaccines, especially among the frontline workers and immunocompressed people. Sir, it is presumed that there is an unstock of between 5 and 10 million doses in the previous sector of in private sector in India, which would likely start expired from 2022 January to February. In case the expert committees of government decided that the booster dose was necessary, then this stock could be used for the boosters for healthline cares and frontline workers and those who are highly risked despite receiving 2 doses. The objective should be to minimize wastage of the precious resource. Sir, finally I conclude, I would request the central government to ensure that precious stockpiles of vaccines are not wasted and put into good use, and in the light of experience of having dealt with the pandemic situation before, to learn from the previous experience and take adequate preventive measures so that people do not suffer precious lives or not lost, sir. Finally, I would like to tell only one thing I just learned from COVID. Be fearless and be strong, then only you will be, sir. Thank you, sir.
Thank you. Next speaker, Sri Kausalendra Kumar ji. Not present. Sri Achudanand Saman.
माननीय अध्यक्ष महोदय, आपको धन्यवाद देता हूं, आप इस विषय में मुझे बोलने के लिए समय दिए हैं। एट द आउटसेट ये मेरा कर्तव्य है, जितना भी कोरोना वॉरियर्स है, आशाकर्मी हो, सफाई कर्मचारी हो, डॉक्टर्स हो, नर्सेस हो, पुलिस भाई बहन हो, इवन जर्नलिस्ट भाई बहन हो, इस सबको मैं नमन करता हूं। एंड साइड बाय साइड जो भी ये लोग से सेवा करते करते एक क्राइसिस टाइम में गुजर गए हैं, उन लोग को आत्मा को श्रद्धांजलि ज्ञापन करता हूं बीजू जनता दल तरफ से। इस सिलसिले में मैं बोलना चाहता हूं कि ये जो इतना बड़ा महामारी विश्व को आया, जिसके बारे में किसी को कुछ पता ही नहीं था पहले से, 2 साल का आसपास हो जाएगा, लेकिन इसमें हम लोग सबको धन्यवाद का पत्र बोलते हैं। माननीय प्रधानमंत्री हो, स्वास्थ्य मंत्री हो, हर राज्य का मुख्यमंत्री हो, एंड एंटायर सेंट्रल एडमिनिस्ट्रेशन और स्टेट एडमिनिस्ट्रेशन, सब लोग कंबाइनली जॉइंटली इतना अच्छा से क्राइसिस टाइम में, महामारी टाइम में सब काम किए। मिनिमम आम आदमी लोग को आशा भरोसा दिए, सब कुछ अरेंज किए, इसलिए इतना बड़ा महामारी हम लोग अच्छा से अभी तक निभा पाए हैं। इस सिलसिले में मैं पहले बोलूंगा, सबसे ज्यादा धन्यवाद का पात्र है आवर ओन पॉपुलेस, इंडियन पॉपुलेस, जो इतना बड़ा आबादी है। मुझे ख्याल है जब कोरोना महामारी आए विश्व में, इंडिया में, एंटायर मीडिया इन आउटसाइड इंडिया डिस्कशन कर रहे थे जो इंडिया का पॉपुलेशन इतना बड़ा है, इतना ये है, कैसे कोरोना महामारी ये लोग जूझेंगे, लड़ेंगे, क्या करेंगे। लेकिन सारा दुनिया देखे, बिकॉज ऑफ द कंबाइंड एफर्ट ऑफ द एंटायर एडमिनिस्ट्रेशन, प्राइम मिनिस्टर, चीफ मिनिस्टर, एवरीबॉडी, but also the decent and disciplined attitude of the people of India has shown the entire world जो प्रैक्टिकली हम लोग कैसे इसको कर पाते हैं। इस सिलसिले में मेरा एक याद आता है जो हम लोग बोलते हैं सब टाइम, यूनाइटेड वी स्टैंड, डिवाइडेड वी फॉल। कभी भी कुछ क्राइसिस आता है देश में, सब लोग यूनाइट होते हैं, ये मेरा स्मॉल नॉलेज बोलते हैं। इस सिलसिले में नेचुरली हम लोग को सबको पता है, अभी 2 ग्लोबल क्राइसिस सबसे ज्यादा हो गया है। एक तो ग्लोबल क्राइसिस चल रहा है कोविड-19, एंड दूसरा ग्लोबल क्राइसिस है क्लाइमेट चेंज। तो ये जो 2 ग्लोबल क्राइसिस अभी हुए, जिसके वजह से आम आदमी परेशानी हो रहा है। एंड दिस पेंडेमिक इज ऑफुल बट द क्लाइमेट चेंज इज वर्स। COVID-19 and climate change both are grave challenges that the humanity is grappling with today. As awful as this pandemic is, climate change could be also worse. अभी जो ओमिक्रॉन आया है, वो बोल रहे हैं सब कुछ हो रहा है, इसका बारे में अभी सब लोग भयभीत हो गए हैं। एंड आज मैं देख रहा था टीवी में, चीफ साइंटिस्ट ऑफ हु बोल रहे थे जे अभी तक इसका बारे में पूरा रिसर्च नहीं हुआ है, पता नहीं चला है, लेकिन मेरा जितना भरोसा है, जैसे डेल्टा डेल्टा प्लस के बारे में डिस्कशन कर रहे थे, वैसे ओमिक्रॉन जो भी आ रहा है डेफिनेटली इसको भी इंडियंस एंड द एडमिनिस्ट्रेशन इसको अच्छा से हैंडल करेंगे, जिसका को हम लोग ओवरकम करेंगे एंड पीपल इन इंडिया विल बी डेफिनेटली सेफ। इन दिस कॉन्टेक्स्ट मेरा बोलना है अबाउट आवर ओडिशा स्टेट एंड ऑल्सो द लीडर्स ऑनरेबल चीफ मिनिस्टर नवीन पटनायक जी। Definitely, he turns all adversities into opportunity. A kind-hearted Samaritan who talks and walks the talk. A leader ahead of his time. That's why हम लोग को सबको पता है that Odisha ranked number 1 in COVID-19 management as per the strategy, as per the survey of the mood, and also the national survey इंडिया टुडे। आज का दिन में वैक्सीनेशन में ओडिशा इज मच मोर देन द नेशनल एवरेज। 85.65% population in Odisha already vaccinated single dose and 49% already vaccinated the double dose. And our honorable chief minister has taken many steps in much ahead of the other states. In this context, I can say the creation of COVID-19 hospitals and free treatment, COVID care centers, quarantine centers, etc., free education to the wards of COVID-19 disease, financial assistance package that covers almost all sections of the society, starting from COVID warriors, journalists, farmers, even जो रास्ता कार्ड में बिक्री करते हैं, वेंडर्स, सब लोग के लिए, एंड इंक्रीज ऑफ सोशल सिक्योरिटी पैकेज, इंक्लूजन ऑफ डिजास्टर एंड पेंडेमिक मैनेजमेंट कोर्स इन द करिकुलम, एंड सबसे बड़ा काम किए हैं जब ऑक्सीजन का अभाव पड़ रहा था, सबको पता है, सप्लाई ऑफ दिस मेडिकल ऑक्सीजन इन द ट्यून ऑफ 7,723 मेट्रिक टन टू 17 ऑक्सीजन डेफिशिएंट स्टेट एंड मेनी अदर थिंग्स। लेकिन सबसे अच्छा चीज है इन दिस केस ऑल्सो मैं बोलूंगा, जो जून में दिस ईयर ओडिशा गवर्नमेंट ने एक अनाउंस किए हैं आशीर्वाद योजना। आशीर्वाद योजना के वजह से जितना ऑर्फन बने हैं बिकॉज ऑफ दिस कोविड इन ओडिशा स्टेट इट इज 1773, सबको 2,500 हर महीना बैंक में डिपॉजिट करते हैं एंड इट विल कंटिन्यू अप टू द एज ऑफ 18। Similarly, if we see there are some steps taken by the government of Odisha from the early stage to contain the spread of this virus and break the chain of infection. As soon as the first case was reported in Odisha on 16th March, our Honorable Chief Minister has put this lockdown in advance of the central government, which is on 24th March. Even in this case, I can say, additionally, Odisha government engaged women self-help groups to assist with awareness generation, ensuring public health and hygiene, and providing food security in rural and urban areas to poor and vulnerable groups, especially during the lockdown. हम लोग को सबको पता है जे जिस सोसाइटी में, राज्य में, देश में माँ बहन जितना इन्वॉल्व होते हैं, महिला लोग जितना इन्वॉल्व होते हैं, वहाँ कुछ भी समस्या रहता नहीं, कुछ भी समस्या आता है दूर हो जाता है। इस सिलसिले में हम लोग का माननीय मुख्यमंत्री को धन्यवाद देना पड़ेगा। वो कैसे सेल्फ हेल्प ग्रुप को, एंटायर वुमेन ग्रुप को इतना अच्छा से इन्वॉल्व किए महामारी टाइम में। बिकॉज ऑफ दैट ओनली इन ओडिशा वुमेन आर द फोर फ्रंट ऑफ द बैटल अगेंस्ट दिस पेंडेमिक। 7 million women of Mission Shakti have taken the lead in crucial initiative responding to the pandemic, helping contain the spread of the virus, providing various community services. इस सिलसिले में मैं बोलूंगा, SSG group helped implement the Mo Jiban pledge to all the people and educating 15.3 million persons so as to break the chain of contact. Many of them have also helped spread awareness about social distancing and safety in rural areas. These groups have been engaged in ensuring public health through 1339 Mission Shakti SSG who have experience in stitching garments and producing jute items. They own commercial tailoring equipment एंड आप सुन के खुशी लगेगा 6.5 मिलियन रीयूजेबल मास्क ये लोग प्रोड्यूस किए टू डिस्ट्रीब्यूट अमंग द फ्रंट लाइन वर्कर्स एंड 0.3 मिलियन मास्क दे हैव डिस्ट्रीब्यूटेड फ्री ऑफ कॉस्ट बाय एसएचजी अमंग द पुअर एंड vulnerable as a precautionary measure to contain the pandemic. This not only helped the protect public health, but also it promoted the livelihood of the rural women. Similarly, in this context, I would also like to add